It's awards time, everybody. Very exciting. Let's give ourselves a clap and a whoop. Okay. So you're going to present the awards, aren't you? Yes, yes. Do we have the awards, the physical awards? I don't know how we do that. Oh, they're over there. There we go. Right, that's that bit ticked off then. You're waiting in the wings over there, looks like, doesn't it? So, right. So it's time to find out if you're a Health and Care Research Wales 2025 award winner. The awards celebrate the achievements of the research community in Wales over the past 12 months. There's 4 awards to give out. Gareth, are you up to the job?
I am.
Good. Public involvement, health and social care impact, rising research star, and a new one for this year, which is embedding research in practice. We've just been talking about that. Thank you to everybody who entered. We received a very high standard of submissions, I am told, for the awards. And thank you to the judging panels as well, because that takes a lot of time and dedication to get that fair and right. The winner of each category will be awarded funding of up to £250 to attend a training course, conference, workshop, or similar event to develop an area of their research skill set. So something to set you off. So please feel free also to share your congratulations with the hashtag we've been talking about. So that's Research Wales 25. You can put it in the chat box if you're online as well. And of course, share it on your chosen form of social media as well. So without further ado, let's get on to the awards. And our first award is Public Involvement. This award recognises the very best use of public involvement in a health or social care research study using the UK standards for public involvement. And the winner is, let's have a little drum roll, it is Cascade Parents Research Advisory Group. Congratulations to them. Let's give them a round of applause. The panel was very impressed with the clear demonstration of exemplary public involvement activity in the practice. The ability to demonstrate meaningful and impactful governance is testament to the well-structured, long-standing commitment to their involvement over several years. And I think there's a video that we can watch to have a look at Cascade's Parents Research Advisory Group's work. Let's take a look.
Hi there, I'm really excited to be able to tell you about our Cascades Parents Research Advisory Group. So the group is made up of people who have lived experience of child protection interventions in their lives, and they work with us here at Cascade. This year, in July, we had a paper co-published with the group in the British Journal of Social Work. So the paper is all about how the group was set up, all the different kind of challenges and ways and things that we considered when we were setting it up, and it's from both the perspective of the parents themselves, but also from us at Cascade and how we've worked together to build this group. So we think this is a really important and unique contribution to the public involvement debate, thinking specifically about this cohort and group of people who are often marginalised and are not always heard within public involvement, but also because the group is run regularly like a standing group, which isn't always the same format that's used within public involvement. Some of the key debates that are covered in the paper are some of the power imbalances, the diversity, the idea of representation, but also the impact that comes from research, both in the wider society but also with the parents themselves.
Congratulations to Rachel Vaughan and her team at Cascade for our first award for public involvement. The next award is the Health and Social Care Impact. This award recognises the difference Welsh research is making to people's everyday lives and the difference people can make to that research. The panel were very pleased with the range of submissions across topics and types of research, saying it's always difficult to choose between impactful projects driven by the public and patient benefit. But one project did stand out for them when they were judging against the criteria. So This year's Health and Social Care Impact Award goes to Kerith Waters and team for their Health and Care Research Wales-funded perinatal mental health intervention based on acceptance and commitment therapy, ACT. The panel noted the importance of the topic with its links to both health need and policy priority, the clear public involvement throughout its expert reference group, and the train the trainer approach, which has led to uptake in 5 university health boards in Wales, and it says, and counting, so still more to come. Congratulations to all of the team with Kerith Waters for the Health and Social Impact Award for their research-funded project. Let's give them.
Untreated mental health conditions during the perinatal period can have a profound adverse impact on women, children and families, and there's a dire need to develop psychological interventions for the treatment of moderate to severe mental health conditions. I developed an acceptance and commitment therapy-based intervention for the treatment of mental health problems in Cardiff and Vale UHB.
We feel the intervention has had a great impact as we provide supervision. As a supervisor, I've personally noticed within supervision sessions, the facilitators have grown their own knowledge and skills in using the ACT model.
What it also showed though was that actually staff had increased psychological flexibility. So that's one of the core aims of ACT. So staff were kind of saying that actually we felt more present. We were kind of engaging with our thoughts and difficult feelings. So our funding has also allowed us to create really equitable and strong partnerships with lots of different sites internationally and nationally. And what that's meant then is that we've had really interesting conversations around how the intervention needed to be culturally adapted to ensure that it did serve the needs of those who were coming to the groups.
Well done on your Health and Social Care Impact Award. And fantastic to have the videos to give us an insight into the work a little bit more as well and understand it a little more. So thank you very much for those. The next award, the third award this afternoon is Research Rising Star. So the stars of the future, which we've talked about a little bit today as well. This award is for researchers who are rising research stars in the early stages of their health or social care research career and making significant contributions to their field and an emerging future leader. The panel say they were impressed with the number of high-quality submissions once again for this category, increasing from last year, which is great, isn't it? The future is bright, and pleased to see the level of early career researchers that we have in Wales who are making that difference to health and social care research. They said it was a really, really difficult decision to make. So, let's have a little pause, build up the tension. So the winner of the Research Rising Star Award goes to Violetta Zelek, who is the worthy winner this afternoon for her pioneering work. Pioneering work as a Race Against Dementia Fellow and UK Young Academy member, just making her way to the stage. She holds patents, develops iPSC models, including induced pluripotent stem cells. She could probably explain that if we had time for her to speak. And licenses technologies globally. Passionate about mentoring, she leads national training and supervises PhDs and MSc students in her research, recognised in Wales and internationally, and it's making a significant impact. So let's take a little look at it in more detail.
Hello, my name is Dr. Viola Zelek. I am Senior Research Fellow at Cardiff University and an emerging leader at the UK Dementia Research Institute. My research focus is on a part of the immune system called complement. So complement normally is there to protect us from infections and to clear away debris and dead cells. However, when it goes wrong, it can damage all tissues, all cells, including brain. So I'm developing new therapies which block this harmful activation and dysregulation of the complement system with the aim to slow down or prevent disease progression. And what drives me is the hope that one day these drugs candidates will improve quality of lives people impacted by dementias.
Let's have another round of applause for Violetta. She's been up to get her awards. Congratulations to you on the Research Rising Star Award. So number 4, embedding research in practice. This is a new award for this year. It recognises the achievements of individuals or teams within their field of practice, where as a result of their achievements, research has then been embraced and integrated into services. So seeing that end result of it being delivered and is a core part of the organisation's culture. So who is the winner in our Embedding Research in Practice Award this afternoon? So our winner is Jonathan Underwood and the SNAP trial, an excellent example of embedding research into clinical care. Let's give him a round of applause.
It should be the infectious diseases research team. It's not me, it's the team.
It's the team. There we go. Yes, absolutely. So it's the team, the infectious diseases research team, that are receiving the award today. Definitely really important to point out that it's everybody involved, isn't it? Have you got any more of them that want to come up onto the stage to with you this afternoon? Well, let them have a think while I read out what you've An excellent example. Let's have you all up here. Let's have you all up. So the SNAP trial, and that's an example of embedding research into clinical care with some really tangible results. The panel was pleased to hear about the embedding research model within the infectious diseases research team at Cardiff and Vale UHB, which has led to research becoming part of routine clinical care and a shift in the team's culture. The application was particularly strong on the successful integration of research staff into clinical teams, with a focus on upskilling staff, which ensures the longevity and growth of the research culture. And all the team have gathered on stage. Thank you for getting everybody up, Jonathan. That's really useful. And let's take a look at the work that you've been doing.
Hi everyone, I'm John Underwood. I'm an infectious disease consultant based in Cardiff and Vale. And this is some of our amazing infectious diseases research team. Hello. And we're just going to talk about how we've embedded research into clinical practice here in Cardiff and Vale and the success that we've got from that.
Many of the trials that we do are in patients who are hospitalised with severe infections, and this is an inherently tricky group of patients to study, and this creates all sorts of unique challenges which require really tight multidisciplinary team working. A good example of a successful trial we've embedded into routine clinical practice is the SNAP trial. So this is an international interventional trial for patients with Staphylococcus aureus bacteremia. We've worked really hard to integrate care so we get a direct feed from the laboratory to the clinical research nurse specialist so we could rapidly identify patients and get them in the study if they're keen and eligible. And as such, we're one of the leading recruiting sites with the leading recruiting site in Wales by quite some distance, and also one of the leading sites in the UK. And this approach of embedding research into clinical practice has been really successful. We've randomised over 1,000 people with infections or suspected infections to different treatments or interventions over the last 5 years, which I think is a fantastic achievement, testament to the great work the team's done. I think more importantly, it shows that even in the NHS in 2025 in Wales, you can embed research into clinical practice. And really, this should just be part of routine clinical care. And it's what we should be doing everywhere.
Thank you very much. And thank you very much to the team and to the SNAP trial for the award this afternoon. And I said there were 4 awards, but there are actually 5 awards, aren't there? Because we've got the one for the best stand as well. The final award of the day is the best engagement stand. It's the one you've all been waiting for, I know. It's been great to see the imagination and creativity that's gone into the stands. I know that takes a lot of hard work as well to man them, and the resources it takes to get all of that going. And it shows how competitive you are as well to all be here today. So let's see who the winner is for the best engagement stand this afternoon, and it goes to the Centre for Trials Research. Woohoo! Have we got a representative? Oh, there's a few of them coming up to the stage now. Come up and grab your award, the coveted award, Best Engagement Stand. Who's going to take it, though? That's the question. Who's going to take the award home? You'll have to rotate it. Let's give them a round of applause as they come up.